Okay, all right. At this time, I'd like to call a meeting to order and start with roll call. Jenny, can you help me out? Here. Here. Here.
Here. Here. Here.
Thank you. Welcome, everybody. Next item on the agenda is the adoption of the agenda. Well, hopefully everybody's had a chance to look at it and entertain a motion or comments, questions.
I will move to approve the agenda, accept the agenda.
Second.
Agenda.
Motion and a second. Any further discussion on the agenda? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda is the approval of the minutes from our April 16th, 2025 meeting. Hopefully you've all had a chance to review those as well.
Just one comment on the section public comment. We talk about tobacco. It says succession program. I think we need cessation. So you can change that word. That would be my only amendment, to change that to cessation.
All right. Any other comments or concerns, questions? Would anyone like to make a motion?
I will move to approve the minutes with the amendment of changing succession to cessation.
We have a motion. Do we have a second?
Second.
Any further discussion on the minutes? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, board president announcements. I have a lot. I guess I'd just like to. The board is wrestling with budget issues and what has come down from the state. It's an unfortunate distraction for us and a burden. And we're all disappointed in what we have to deal with, but we've been here before, and we've got a great crew. And it's sad that this is going to diminish a little bit all the good work that's being done, but that work is still being done. And we've got a good crew, and we'll find our way through all this. So that's that. Next item on the agenda, health officer presentation and report. Dr. Migliori.
The health officer's report is pretty self-explanatory. We have been not quite as busy this past month, partially because of spring break that occurred, Easter. Families are traveling, but also staff were traveling with their families during that time period. We've also been consolidating some positions so that people are learning some new skill sets to their tool belt. But we still had one of those is in the TB department, but we still were able to keep our TB numbers up. So we have a lot of talented workers, a great team. These guys are very passionate about the work that they're doing, and I really appreciate them bringing their A game every day.
Thank you. Any questions, comments for Dr. Migliori?
I had a question about at the beginning, at the bottom of the very first page, communications, event, community partnerships, and environmental health. At the very bottom, it mentions that the lead team was going in and performing lead risk assessments at daycare facilities. So just to be clear, they're going to the daycare facilities to actually do in testing of the environment to make sure that it's lead free.
Right.
Okay. So is this I mean, that's obviously a important place to test. Are you how did that come about? Where did the daycare facilities request to be tested, or are you kind of going to daycare facilities and older spaces? And I'm assuming you don't need to test the buildings that were just built a few years ago, but
so Brianna McCall, Assistant Director of Environmental Health, board. A lot of it I have to say is the care unit, so the community health workers work with it all the time. Oftentimes they're outreaching to get children tested, but recently we started looking at having still get themselves tested. There's quite a few home daycares in the county, and so a lot of times those are built before
Okay. And as even, for example, the remediation programs, I think South Bend still has funding for remediation. If you are a home-based daycare, would you still qualify? Okay.
We actually have a lead conference coming up next week with the daycare in the city of Beaver.
Thank you.
And I don't think we're certifying that they're lead free. I think we're just saying there's certain things we test for and there's no risk, a high risk or exposure to lead for the children. Right?
Yes, and so a big thing is that's actually a really great point. So a lot of times we don't say lead free, we say lead safe because we're just looking for hazards. So we don't test walls that are intact. We might not test the water or the soil if there's not a grade. So we're really just saying if there are lead hazards, but so it's not necessarily that comes up to that pharmaceutical lead or that we're doing these tests where letting them know if they're hazards.
Thank you for the disclaimer.
Thank you.
Because we're gonna be doing budget today, there's no spotlight. I just wanted to really spend time talking about budget.
Oh, I have one more question. In the nursing section about vaccinations, it says our vaccination teams collaborated with the tuberculosis team to complete 21 quantiferon blood draws within a single day. I'm just curious where that happened, what happened.
Actually, Hellman, Director of Nursing. So we work with the IU School of Medicine, and they sent their students to us. We took care of them all here at South Bend over the course of one day, and we were able to get their entire student group tested.
These are medical students that are getting ready to enter clinical rotations, and so they have to prove that they are infectious, proven of active TB. So that's why they got the blood draw.
Does the health department do other nursing? I mean, we have a lot of schools, so a lot of nursing programs in the area and in med school. Do you do that for or offer that for all of the other medical?
Not unless requested. No.
Okay.
We do it for people who are here under a class reunion, so that they're in that program, and we will do quantiferons for them. But otherwise, it's not something that we regularly do.
Okay.
No longer do you see the TB test. You know, when we were kids, they would just prick your forearm and look at your forearm. Those are still accurate, but it's sometimes difficult to get people to come back at that 72 hours and 40 to 72 hours later to read it. And so it's just easier to do a blood test. It's very accurate, and more people are going to the blood test just simply because it's a hassle to place it and getting people to come back in a timely fashion.
My daughter just went through this, and if you have any kind of like reaction at all to the skin test, you have to have blood drawn anyhow.
Right. You do the blood draw. If the blood draw is elevated, the next step is a chest X-ray.
Thank you. Other question? Hearing none, I entertain a motion to approve the health officer's report.
I will move to approve the health officer's report.
A motion and a second. Any further discussion or question? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, new business. Item 25-19, discussion and vote on the 2025 budget, county health fund, Um, I will, the finance committee did meet on the budgets, and I did not, no.
No, this is a 2025 budget I wanted to amend.
Oh, we're amending the budget, okay. Thank you.
Yes. But you are correct, the finance committee did meet, but we're next step. The request before you is to move some staff members that are currently funded by HFI to the county health fund so we can continue offering the services without having to screen them for citizenship. So that includes our immunization program as well as our blood program. So it's just a swap, removing the salaries from HFI and then putting them into the county health budget. Just for further clarification, when the new budget rolled out and was signed, the day it was signed, it became a law in the state of Indiana, May 6th, that any HFI funds that were spent, whether it was on staff, equipment, anything, and even remote things, the patient or the client had to be certified as a legal resident in Indiana and lawfully in the United States. And so, in order to be keeping the law and not breaking the law, we wanted to make sure that we still offer the pillars, basic pillars of community health, meaning the TB program, the immunization program for the babies, and the lead testing for those kids under the age of 7. We wanted to make sure that we kept those funds and that we maintained Indiana state law. So we had to have sort of a skeleton crew of people that could continue those programmings, doing the testing, doing the treatments, and giving the immunizations that were having their jobs, their salaries drawn from the county health fund and not HFI funds. It was merely for that reason only, no other reason. There wasn't, some people sort of saw that and thought there was some other nefarious reason, but it was merely to keep our TB, lead, and immunization programs legal so that we were obeying the law.
Thank you. Any questions on that?
And that's, we didn't talk about that in the finance meeting.
No, because this is in the finance, we talked about the 2026
Got
budget, but this is something that has come up as of May 6th that we have to address right away because we don't want to break the law.
Yeah, and so the funds that they were using in the HFI, are those being allocated somewhere else then?
Yes, so we're switching people out. So again, those 3 major programs that we feel very strongly we need to be able to treat the children basically. So TB, lead, and immunizations, those 3 programs, we wanted to make sure that those staff, not all of them, but at least 2 or 3 of them were being paid not from their salaries weren't coming out of HFI funding, but rather the county fund, so that we could still carry out those.
And
activities.
no other switching, like,
Well, we had
meaning
to
we
switch,
had it,
we had to take 2 out to get 2 in, so.
it didn't change any of the other numbers though, meaning
No,
other
everything's-
programs, we didn't have to go
budget
like,
neutral. It was just a swap of staffing, yeah, so that we could do the right thing.
All right, there's no other comments or questions, but I will entertain a motion.
oh, can I ask one question?
Sure.
Sorry, I just wanted to be clear, when it says proposed salary for the 2 community health workers, the salary is per, on this side is 43,000 is per community health worker, but when it says proposed salary of 43.14 per hour, is that for both of them? Is that a?
No, that's the nurse, that's the immunization
Oh, okay.
nurse.
Oh, I see. Okay, I see what's going on. I just saw part-time and I didn't realize what that meant.
Yeah.
Got it. Okay, never mind. Thank you.
Any other questions, or I'll entertain a motion.
So the motion is just basically to.
The motion is to transfer funds, transfer.
Transfer staffing, so if you have like,
Staffing.
just as an example, yeah, positions.
We're flipping positions from
So
one
say,
budget side to the other.
yeah, so say somebody, somebody who inspects septic, yeah, that is, they're not.
No,
we
and I-
switch to the HFI.
No, and I get it. It's just to make the motion. I need to make
Gotta
sure that
properly phrase.
Right.
it's properly phrased. So I need to
I got confused. I moved to swap
the position.
the positions
From,
as requested. As requested.
Second.
All right, we have a motion and a second. Any further discussion?
Actually, can I ask another question?
Absolutely.
Okay, so, we are switching, this appropriation is to switch money, switch these people into the county health fund and out of
Correct.
health first.
Yeah.
Do we need another appropriation to switch people out of the county health fund into health first?
No, this is just moving staff into the county health fund. We're not swapping anybody out at this time.
Oh, okay, all right,
In the 26 budget discussions, when we have that discussion, we're doing some swapping, but for these core staff members, we are adding them to the current 2025 budget without any reduction in the 2025 budget. The reductions happening in HFI. So
okay,
we're decreasing HFI and increasing the county health.
okay.
Sorry, I got
Thank
ahead of myself.
No, it's a good clarification, because I think I was thinking about, having heard about in 2026, that
Right.
switch was what was gonna happen. So this is not a switch, this is just moving
A move.
people into the county health.
So we
And
can
the
continue.
budget that it came from to cover those salaries was where then? You didn't,
Into the
you
county
didn't,
health fund, that's,
there was no switch, like
it's
the
just gonna, the fund balance, the
Okay.
fund balance that we carry, this would be drawn from
surplus
that.
budget. Okay.
And then the rationale behind it is, we want the positions that are dealing with individuals that might have, especially communicable diseases. We want to make sure that we can treat them so that they don't spread.
Right.
That's,
Regardless of the status otherwise.
yeah,
And led the
Right.
kids as well, so it's not their fault. The parents aren't citizens, so.
well, plus we probably have a lot of homes where different people are different statuses. So that itself is interesting. Okay, thank you.
Any other questions? We have a motion and a second. Hearing none. All those in favor, please say aye.
I,
Opposed, say nay. Motion carries. Next item on the agenda under new business 2520, discussion and vote on the 2026 budgets. County health, there's 4 county health, local public health services, school liaison, and the trust fund budget. Turn it over.
I met with the personnel committee and the finance committee on separate occasions where we presented some fund projections, and we had 3 projections that we presented. The first projection would have us solvent until the beginning of 2028. The second projection would have us solvent until the beginning of 2027. And the third projection would have us solvent until the beginning of 2030. With that being said, the budgets that we are proposing today and that have been presented to the finance committee follow the proposal or the project or budget projections of the third sheet that we have, which would make us solvent until the beginning of 2030. Starting with Fund 1159, which is our county health fund, which is our main fund, which is tax revenue and fee revenue generated. We have the 2 columns there, what our current 2025 adopted budget is, and then what we are proposing for the 2026 budget. Overall, all the way down to the bottom, it is a reduction of around $201,000. Personnel does have some significant reductions where we are. This is where we're doing some swapping, moving some staff to HFI, and then moving some additional staff from HFI, as well as elimination of some positions. When we go down through supplies and services, which is the next 2 groups, any increases are because of the lead program, TB program, and the immunization program. Instead of having that funding in HFI, we're just putting it directly right into our county budget. So overall, the reduction is around, I believe, 4% from our 2025 ask. Are there any questions?
What did you, Sorry, what did you say again? There's 3 categories: lead, vaccinations,
And
and
TB.
DB.
TB.
Yeah.
Okay.
The items highlighted in yellow, fuel allocation, fleet allocation, and liability insurance coverage. Those amounts did not increase nor did they decrease. Those amounts come directly from the auditor's office. So once they give me the exact numbers, I will make that adjustment as needed. We will need to meet again as a finance committee or board of health since those are given to us from the auditor's office. But just to note that the budget may go up or down depending on what those numbers actually end up being from.
Questions? I think we want to hear about all the budgets before we do any voting, would be my suggestion. Is that all right? Okay. Move on to the next.
Going on to the local public health services grant, which is the HFI grant. Same thing with the personnel here, just the swap of what was listed in the county health fund, bringing 3 from the county health and putting 4 into the county health from HFI, and then eliminating 10 positions here. And as we look at the 20,000 and 30,000 series, there's a lot of red, a lot of large reductions. We are not eliminating any programs. We're just trying to do more with less. When we look down at some of the categories at the very bottom, like chronic disease prevention, injury prevention, those programs are still funded. We're just using account names that are more specific. So if they have travel, it's now listed under travel instead of having a pot of money. We're being more specific with what the funds would actually be used for. So it looks like these, there's no funding for that. It's just being reallocated to, more specific line item. Same thing here with the liability insurance coverage. That amount could go up or down depending on what number comes from the auditor's office. If you go to the next page, Jenny, it looks like overall, this budget, we're requesting nearly a 67% reduction from the 2025 adopted budget.
And that's again not our thing. That's the state thing that they took money away. This is not us trying to cut things. It's
That the state took away 73.3% of our HFI funding. So there was $115,000 disseminated the last 2 years for all 92 counties.
Million.
A million, sorry. And then the next 2 years will be 40 million. So you went from 150 to 40, and if you do your math, it's 73.3% reduction. And so you can see this is HFI money, and we lost 73.3, and we're taking 67% off.
now our projection for next year is that we are entitled to, we would get 1.7 million for next year in HFI
And 27
in 2020 fiscal 2026
and 27
and 2 years.
So
Okay,
yeah,
2
2
years.
years.
Which we are planning to apply for. But that would mean that we would also, but we also still need to have a separate tobacco cessation, that we'd still have to have those requirements in place.
We're still
so that-
required to deliver the same services, and the tobacco cessation program has been eliminated but rolled into the school liaison, school nurse liaison.
But it's not required for HFI.
Correct.
No longer required.
So we're still gonna have the programming that HFI requires, just a little more bare bones.
And no,
We have, if we want the money, we have to provide the programming.
Yeah.
So there's no, if you don't provide the programming, you don't get the 1.7.
Okay.
Amy, Amy, in dollars, could you just state what our funding was 2025 from HFI and what it's going to be in 2026? Just to,
Our 25 amount from HFI was around $6.34 million. And for 26 and 27, it's going to be around $1.7 million each year.
so you can see it's a huge
Mhm.
reduction.
So 1.7 million each year.
Correct.
So in 2026, we get 1.7 million.
And then in 27, you get another 1.7 million.
Would
It's a 2-year budget.
but that's locked.
Unless there's a budget session in terms of the state house does next year. So it would be literally a
But
new act.
we don't want to bet on that.
Yeah.
It's unlikely.
And the $400,000 difference that we are making up is coming from our reserves. Because our 2026 proposed is more than the 1.7.
Correct,
So-
correct. And we have unspent funds from both 24 and 25 that we will have to dip into, yes. So the budget that I have to submit to the State Department of Health will have to be for the $1.7 million. The budget we're approving today is going to be what we actually need in 2026 to run our program. So it is going to include the 1.7 million plus some unused funds from last year and this year.
And when we get past that, where we are no longer getting the 1.7, then we have to reevaluate programs. Because we are not going to have that money, so.
Well,
Well, they
there'll be a new budget session
Yeah.
in 2 years, and so at that point, the state will tell us how much money we did, if it maintains, if it decreases, if it increases, and then we will readjust based on the funding available to us.
We're not expecting to jump over. I mean, that's not say it couldn't, right? But
I think the way the HFI funding is set up is that it's like a whole revolving through 2 years. At least like that would be right. I mean,
But luckily, and kudos to you and this entire health department, we have a surplus that we can continue these programs because we have money that is set aside. Otherwise, we'd be in trouble right now.
Good point.
I'm moving on to the next budget, which is the school liaison budget.
Can I hold you up just a second? Any questions on any of these items that anybody wants to ask about? And one thing I wanted to point out, I think, item 33034 grant monies, that's just grants that we've given out to our community partners so that's just not gonna happen.
Oh.
I'm just looking at some of the bigger numbers just for everybody's information.
Yeah, and we still have to meet all those health goals,
Mhm.
so it's a lot of work.
well, and some of this money, like rent and other things, it was kind of planning for the future, and that's not going to happen. At least in the either. So that's where some of that's coming. I think, correct.
Correct, yes. We're hoping for enough improvements to our working space for efficiency's sake and
Yeah.
general office environment that is no longer going to be in the budget, at least not this year. Thank you.
And moving to our school liaison budget, this fund does not receive any new revenue, but it does have a fund balance of around $1.5 million to be able to fund the staff member as well as the programming for that school health liaison project. They are asking for a reduction of around $46,000. Some of that is due to the donation from the Fair Foundation. We don't know if we will, receive any, that donation again or any donations in 2026. If we do, then we would have to go through the appropriation phase to get that available to use. So just a reduction in a few line items here for that school health liaison program.
Any questions on this fund?
That's one, John. And our last budget for review is the trust fund. This fund will, I probably over budgeted what will be left from the end of this year. I just want to make sure I budget more than what's going to be left. That way I don't have to go to the council and ask for a $5 appropriation to get it used up. So we might not, chances are, have $96,000 at the beginning of 2026. But this fund is for our vector program and just utilizing that for salary and then some supplies, and then everything else for this program is in HFI, the budget, 2 budgets ago, for programming and supplies and services. So once this fund is used up, there are no new receipts coming in. It will be eliminated.
Do you expect this fund to be used up in 2026?
We do.
Any questions on the trust fund?
And at that point in 2027, this will have to switch over to town fund. I assume we'll continue that.
It'd probably first go to HFI, and then possibly the county funding. Because right now, as I mentioned, the rest of the supplies and services for this program is already in HFI 2 budgets ago, and we'll be bringing over the now.
The finance committee did meet and go through the various scenarios. They did recommend that the budget before you is the one that we go with. We did look at, rather than maintaining operations to 2030, because we run out of money, we did look at shortening it. And I think the general consensus was that wasn't fiscally responsible. We would have no emergency fund, rainy day type funds where something major comes up, where we need funds to address a crisis, we wouldn't have it. So I think that obviously the committee voted for this budget because we felt that was a nice balance between being conservative and maintaining a fund for emergency sake and keeping the operation very effective and functional. Anything else, Amy, or any other questions for Amy or Dr. Migliori?
We anticipate continuing the same programming. It may not be as robust as before, but we are required by state statute to continue the programs. And just as another piece, so our budget is basically for the 4 funds that are listed here: the county health fund, the HFI funding, the school liaison, and the trust fund. We have no other source of funding because the state funds that we used to get were wrapped into HFI funding. So we're still looking for grants. A lot of people are scrambling for grants right now. So it's a tough gig out there, but we're still looking for grants and looking for ways to support some of our programs.
That's a great point. Thank you.
And also the county, we are given a certain percentage from the county every year to go to the county health fund, and the taxes have gone down in terms of property taxes. So the county itself has been put in the precarious position of having less funding come in from those taxes that they were getting before. So that also is a little bit of an extra thing that contributes to our financial situation.
Well, and I mentioned this in the finance meetings, I think it's okay to say, but this is why it's important for the community to be able to stand behind the needs of the community. And if there's people that have a passion for different areas of what we do, and we're starting to cut back those programs, we are more than happy to partner with the community, and with just like we have the school grant, it makes a huge difference. And I feel like that's important for the community to understand is if my taxes didn't go down, but if your taxes did go down, if you do have more money in your pocket, then think about, it's nice because you can spend it where you want. You can take that money and put it into the passions you have. And if that's helping people through public health, then that's, go to.
I think, remind me, Amy, every year we're operating under this current budget as being a deficit of roughly what?
Around 800,000 for $1 million.
So we're using up the rainy day fund.
Right, we are using up our fund balance, each year. And, between the two, when we did our projections, we like looked at the county health fund and the HFI fund together. They got around $1,000 to $1 million each year.
So currently raining. But, mm, yeah.
Was there the 92 county, were the standards, were there a set of rules applied for budget in all 92 counties? Or was Marion County maybe different? Stuff and percentage-wise reductions, Fort Wayne, Gary, you know, centers, deficit of large, smaller, based on economic factors and county that are supported on the government. For example, I can't see the north end of Marion County maybe not suffering in their health department area the same way that we're suffering in South Bend. So I'm just wondering, were there an equal set of rules applied across the board that resulted in everybody, all 92 counties, receiving a deficit, or was it sort of determined by where you started and then what reductions could you be made by, by the state?
What we were told when we were made aware of the vote on the $40 million, we were told by the State Department of Health that it's not going to be just a straight across the board, whatever you received in 25, it's not just going to be reduced by 73.3%. They're going to have to do some work and figure out how to divvy up the money. Our amount was literally like 73% of what we had received. So I don't know what their formula was. I know in the past they had used like the CDC index, and that was taken down from the website, so they were no longer able to refer to that for funding. But looking at the spreadsheet, every county did receive less than what they had in 25. I don't know what state's, process was for, divvying up the money, because ours was pretty close to that 73%, off the top from 150 million to 40 million.
So even though the state legislature budgeted 40 million for HFI for the next 2 years, but it was the Indiana Department of Health that determined how it's divvied up among the counties?
That's correct.
Okay. Because I know what I saw, maybe Michelle, somebody saw a spreadsheet of what all the counties are getting. And some of the counties are getting very small amounts of money. Now, they're very small counties. But regardless, every county that accepts that money has to provide programming in 16 areas. Yeah.
The 12 preventive and 3 regular quarters.
Okay. So for some of the smaller counties, there might be an issue of whether it's worth the money. I don't think that's true in our county. It still is. We still need it.
The past 2 years, they also factored in the social vulnerability index, and that's the index that was out on the CDC website, and that has been removed from the equation. So the first 2 years, they used that also to factor in the money, but they didn't this year.
Okay.
And if some counties do opt out of funding, then the state will divvy up that money to the counties who have opted in. But if all counties opt in, then our amount will stay at 1.7.
Okay.
01.
Okay.
My usual question on budgeting and budget approval. Can you walk us through what's gonna happen, why we're doing this now instead of later in the year and all that?
Of course. The HFI budget is due to the State Department of Health by June 1st. So once we have an approval on the numbers, I already have the template ready to go to send off to the State Department of Health. And then the other 3 budgets are due locally June 16th. So those I have to enter into the financial system. After that, we will have our one-on-one meetings with the council, commissioners, auditors, and that is tentatively scheduled for, I believe, end of July, first few weeks of August. We'll know that date as it gets closer. And then it will be presented to the county council for their local approval. I believe it's like October 21st. So deadlines are early. We just started 2025 and we're already having to document accomplishments for 2025 in some papers. But yeah, the deadlines are just earlier than what they have been in the past. Actually, we used to have until June 30th to submit budgets. So.
But they probably, with property tax, changes to property taxes, they probably need more time. So it'll be an interesting summer.
Sure, absolutely.
What is the knowledge of our community health partners of this process and what will do to Central County Health Department and the community? We have any?
We had to send letters of attestation to all of our community health partners so that whatever programming they are providing to the communities through the HFI funds, that they too are following the law in terms of providing using that money to provide programming for lawful U.S. Indiana residents. And so they're aware of it because they have to sign. We're not telling them how they have to do that, but they do have to sign that agreement with us that they will use the money in a legal fashion. So for sure, our community partners know about it, and they have been asking what's going to happen to the program.
So you're saying Beacon Health System and St. Joe Medical Center is aware of this deficit that we're dealing with and the lack of funds needed for what we've been doing for a number of years.
Yes,
Okay.
they themselves are having funding crises on multiple fronts.
Mm-hmm.
The health system is not healthy.
So everybody is aware that we're not doing a grant program of any kind with our
Well,
partners after next year.
I don't know that it's made, large media. I know I've read like letters to the editor in the newspaper, and our current partners are aware of that. I'm sure that there's going to be more people asking around the time of the year, which is August, hey, when are we applying for grants? And they'll find out then. But it may not be on their radar, and it's something that I don't know if we need to put out some sort of news blast on it that we're not going to be doing this, but people who are currently involved with it certainly know about it.
No, but we also currently have something in-house that touches on each of those 16 metrics.
Absolutely.
Is it 15 now? It touches on each of those metrics for HFI.
Yeah.
So we'll be in compliance with what's required on our end in order to be eligible for the HFI.
Correct. And we report those through the Red Cap system every month to the state. The state uses Red Cap as well, and we just push it through every month once a month.
Because I know we're using the grants to help check those boxes,
Right.
but we still have something in place.
We
Again,
have our own,
not as much as we had before, but there's something in place that will check all those boxes.
All right, any further discussion? If not, can we approve these all in one motion? Entertain a motion to approve all or some of the funds.
I move to accept item 2520 stated on the agenda.
Okay, we have a motion. Do we have a second?
Second. You want to
Motion.
do it?
Motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, grant request, discussion and vote to receive the naloxone kits. I don't know why.
Doctor certified you.
Narcan, yeah. correct.
Hello, Renata Williams, Director of Care Unit, Second Floor Law Building. A couple months ago, I came before you to ask for approval to apply for the IDOH grant to receive 3 Narcan kits. We were awarded the grant. It provides up to 6,000 doses of the Narcan kits, which will be supplied in the public access cabinets we have throughout the county and during trainings for community members and community organizations. So asking for approval to now receive the grant.
Great, thank you. Any questions?
I'm assuming, I guess it's an unfortunate question. We need 6,000. We do some up.
Well, it's up to
Okay.
last year, I think we ordered just about 6,000.
Okay.
Not to say all of those was used at one time, it's throughout the year.
Yeah.
And
But
the more people we train and equip with it.
Okay. So to stock all of the, I think when I'm calling it that, but the access.
Public access.
Yeah, the public access boxes. Thank you. And how many years have we been getting this grant? It's been for a number of years, right? If you don't know, it's okay.
I do not know. I could say I came in 2023.
It predated you.
I think 2022 though.
I would say, yeah, 4 years,
Okay.
almost. It's not quite 4, but it's about 4.
Okay. But this should supply most of our needs for the year.
Yeah, yes, it will. And we have things that you don't even think about, like there's a freshman Notre Dame class of about 100 kids that come in, that one of their assignments is to come into the health department and get a Narcan kit that's part of their class, it's some sort of educational thing, but they come in and get the kit and the professor wants them to carry it with them everywhere for them to understand that how important it is to be able to save somebody's life potentially.
Now, do you actually have to use some of the kits as part of training? Like
They're
do you-
trainers.
Oh, they're training kits. Okay. So you're not using any of the 6,000.
No, the 6,000 that are ones that we're passing out to these college. This is just an
Throughout the
example. Yeah, throughout the community that they're using this particular class, the professor wants them to keep it with them and if they're at a party or something, you know, to be able to save somebody's life potentially.
And when we do the training, there's materials and videos. It is great. So it's like a same as.
Okay.
Any other questions, comments? If not, I'll entertain a motion.
I move to accept item 25 and 21 on the agenda.
Motion, do we have a second?
Second.
Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda is old business. We have nothing in that category. The last item is public comment. Danny, do we have anybody signed up? Nobody signed up. Very good. Next item on the agenda, time and place of our next regular meeting, June 18th, 2025, 4:30 right here on the 4th floor of council chambers. We are adjourned. Thank you, everybody.